Hi everyone, my name is Dr. Ganesh Veerapatraya. I am a consultant neurosurgeon, brain and spine. Today we'll know about concussive head injury. Now we'll know about what is concussive head injury, symptoms of concussive head injury, what symptoms you should not neglect after concussion, complications of concussive head injury, management of concussive head injury, that means how we will manage it, how we will treat it, sports and concussion, general tips for concussion. Concussion is a mild form of traumatic brain injury. 75% of the traumatic brain injuries are concussions. Concussions can occur due to impact over the head. Most common reasons are road traffic accident, fall from height, assault, or whiplash injuries, and sudden flexion and extension movements. Actually, concussion means shake violently in Latin. That is concutere will tell. After the impact, brain will temporarily stop its function. Children can also have concussions like adults. Most common causes are fall from height, sports related, road traffic accident, and child abuse. Interesting thing to note about concussive head injury is it's a low velocity trauma. That means after low velocity injuries it can happen, and loss of consciousness may not be present always. It will not cause permanent injury to the brain, and it is not life threatening, but symptoms may need treatment with the neurosurgeon. Secondary concussions are more serious and dangerous. Secondary concussions means once primary concussion already present, again one more concussion happens, person suffers, which may happen most commonly with boxing and wrestling, where repetitive injuries are common. What is concussive head injury? Concussive head injury is an injury that occurs after the direct trauma to the head or violent shaking of the head and upper body. This can also occur rapid acceleration and deceleration of the head, as in whiplash injuries, blast injuries in war zone. There may be movement of brain tissue within the rigid skull surrounded by the fluid called cerebrospinal fluid. There will be a transient physiological dysfunction of the brain wherein brain will not function for some time, which results in symptoms. What are the symptoms of concussive head injury? Most commonly, loss of consciousness as soon as the head is impact. Then transient amnesia, that means memory loss. For a period of minutes to hours, there may be a memory loss. And also memory loss can happen just before the impact also and after the impact also, called antegrade amnesia and retrograde amnesia. And next symptom is headache and vomiting. Then seizures, it is called post-traumatic seizures. It may happen as soon as head is impact or few minutes to days after the impact. Then giddiness, if injury to the balancing center happens, there may be a patient may be having giddiness for some time, for days to weeks, or person may be having difficulty in walking. And weakness in limbs, sometimes it can happen, and gradually it may improve. Then confusion and visual dysfunction, maybe blurring of vision, and dizziness, irritability, and loss of taste and smell sensation, and hypersensitivity to light. These are the few symptoms which can happen after concussive head injury. Can person have normal memory after the concussive head injury? Yes, even though few people can have some irritability, behavioral problems, and most of the time, as time passes, patient can have normal memory, and most of the patients will recover fully after the concussion. Even I also had a concussive head injury few years ago. What are the complications of head injury or post-concussive syndrome? It may be focusing problem, concentration problem, sleep dysfunction, insomnia, fatigability, excessive drowsiness for weeks to days to weeks, personality changes, memory disturbances, and post-traumatic stress syndrome. Even in the children can happen difficulty in focusing, memory disturbance after the impact, and difficulty in getting the sleep, etc. What are the investigations advised by neurosurgeon? Most common investigation advised by neurosurgeon after the head injury is CT scan brain plane. Most of the time, CT scan brain plane will be normal. In some special circumstances like in pregnancy, CT scan is contraindicated, then MRI is advised. And what we will do after seeing concussive head injury, that is management. In the emergency department, we will do the physical examination. We will assess the level of consciousness, check the pupils, eye movements, power in the limbs, and also need to inspect for cut wounds over the head and neck. Most of the time, after concussive head injury, persons require neuro monitoring, and medications like analgesics, antacids, proton pump inhibitors, antiemetics if there is any vomiting, and vitamins like vitamin E, so supplement will give, and antibiotics are advised if there is any open wound over the head or neck or in any part of the body. Head injury in sports. Head injuries can happen in sports. Sports has a risk of concussion due to head injury. It is necessary to wear protective gear like helmet and shield, and wearing a helmet reduces 85% of head injuries. It can also occur with baseball, softball, cycling, football, CTE. Chronic traumatic encephalopathy is found in football players. Cricket, hockey, boxing, skating, snowboarding, wrestling, horseback riding, powered recreational driving, bull riding, martial arts. These are the few common sports where head injury or concussive head injuries can happen, and it is necessary to wear the protective helmet. Even after mild head injury, if you are having all these symptoms, you should not neglect. These symptoms include patients who are taking blood thinners. If person is having persistent headache, person becomes more if person becomes more irritable, and persisting vomiting after few days, concussive head injury, and persistent memory disturbance, and persons who have consumed alcohol or recreational drugs need immediately medical help and following the head injury. General tips. Supervision of younger children is very important, and wearing the seat belt while in the car, following the rules of swimming pool or water park. Do not dive in the shallow water less than 12 feet, and some clothes can interfere with the vision. Please do not wear which interfere with the vision. And if your sleep is not good, and if you have not taken adequate rest, do not participate in sports. Obey traffic rules, wear helmet, do not drink and drive, and do not text while driving or walking, and do not do wheeling, which is common in youngsters for fun, and do not involve in physical fights. It can be on the road, sometimes we'll see commonly, or anywhere. Take home message: 75% of traumatic brain injuries include concussions. Concussive head injuries are low velocity trauma. As such, concussions are not life threatening. Concussions will not cause permanent brain injury. Secondary concussions are more dangerous. Brain imaging, CT scan, MRI will be normal. Concussions are managed medically. No surgery is advised to brain. Neuromonitoring is advised after concussion. Antibiotics are advised only if there is any cut wound or open wound. 85% of brain injuries can be prevented by wearing helmet and protective shield. Thank you for watching the video. Have a nice day.